Hello, it's Editing D here. The video you're about to see I shot around about a year ago in summer 2024. No surprise, I'm still waiting for an appointment to come through with the NHS. It's been nearly 12 months. Anyway, when you listen to the video, it's all going to make sense. I'm going to post the video anyway because it's relevant to my journey with HRT. And it flags up a serious health condition that the nurse picked up, which wouldn't have otherwise been picked up because I don't go to the NHS. I rarely deal with doctors unless I really have to, unless I'm completely desperate because of the gaslighting and everything and the trauma that I've experienced from dealing with doctors. Try and avoid them as best I can. But sometimes when you're having issues, you do need to go when you can't work it out for yourself. So please stick with the video, and if there's anything in it that you find helpful, please give it a thumbs up because it helps those little algorithm gremlins to pick it up and show it to other people. Because the way this has all been set up now on social media, they've completely changed the algorithms so that it's really difficult to find the information for people out there. And I'm not the best with social media, so please do pass this on to somebody else who you think the video may help, especially if they've got some strange symptoms and they're not sure what's happening with their body. Women I'm talking about. I mean, men can have similar conditions with dysautonomia, but this is mainly a perimenopause women's health channel. So please do give it a thumbs up and subscribe if you find any information helpful. I have since invested in some lighting and microphones and other equipment to film with, to make these videos better quality because I'm a complete techno numpty. So do stick with it. Even if you just listen, you don't have to watch the visual, you can just listen to the audio in the background. Thank you.
So my HRT review flagged up an issue, a serious issue. Basically, my blood pressure was going all up and down the show. So it was going up, and it was going down, and it was going up, and then it was going down. So I just had to get up to answer the phone, or well, put my phone on silent, my work phone. So I'm not able to work for the next 24 hours. I've got this heart monitor, this ECG, so I've got the 3 things on the chest. And then it's just this little doodad machine. It's not too bad, it doesn't bleep. Actually, I was really worried that it was going to bleep at me, and I thought, how am I going to sleep with this? But the healthcare assistant at the doctor's surgery couldn't actually tell me if the sticky pads that go on you, and the pads and the cabling is made from latex. I mean, this is polyurethane or something, isn't it? And this plastic stuff, but the round sticky pads that it actually goes on, she couldn't tell me what it was made of, and I'm allergic to latex. So I think I'm having a reaction to the glue. So soon find out. I'm going to try and keep it on as long as I can. It's been on 3 hours, nearly 3, yeah, it's been on 3 hours now. So I've got to keep it on for 24 hours, which apparently, according to other people, where I've read online and stuff, it's not long enough to monitor your heart because you need to do it over 2 or 3 days to get the full effects of the condition that I could have, which I haven't actually mentioned yet. So kind of lost track of my timeline. I think because I've been on HRT on and off for about a year now, about 12 months. So I've lost track of the timeline. I think the HRT, pretty sure the HRT review was after 6 months. So this is when the nurse practitioner, I think, will ring up from the doctor's surgery and just ask how you're getting on. So my chest is a bit funny as well, my right lung. Had sports therapy last Monday and I've got all these problems down my right side. It's normally my left side that is the problem, but that seems to have fixed. Most of it seems to be fixed, but it's muscular skeletal issues that I've got. I've just been eating raspberries and I've got bits in my teeth out the garden and it's affecting my jaw. But because my chest is tight with the shift of the musculoskeletal issues that I'm trying to work on, it's going tight again for whatever reason. Probably because I'm dealing with the NHS, which is a massive trigger for my PTSD. And I thought I was cured of PTSD after 20 years, but apparently not. So I've been having a lot of flashbacks this past year, and it relates to estrangement with my eldest child, which I'm not going to talk about because it's private, but it's to do with the menopause and my mood swings and stuff like that though, so it is kind of relevant, but I'm not going to talk about him because it's not fair. And the HRT review, thank God for nurse practitioners, hey, because the doctors are absolutely useless. I say this with anecdotal experience. I absolutely hate dealing with doctors, especially general practitioners. They have a massive God complex. They are mostly depressed and overwhelmed anyway. So, you know, I have empathy for that. But they are just working for the NHS that is designed to palm you off and gaslight you a little bit more with a touch of gaslighting on the side. And this is the whole point of me setting up this video series, to talk about the medical gaslighting, especially surrounding women's health and what women experience. So actually, to make a point on the gaslighting, I need to do another video about it, but so it's taken me, back to this again actually, it's taken me 12 months, no sorry, 12 weeks, 12 months is how long I've been on HRT, 12 weeks to get this heart thing, this heart monitor, because my blood pressure was going up and down all over the place, and the healthcare assistant at the GP surgery said, is your blood pressure making you dizzy? And I've got cervical spine issues that make me dizzy, and I've been going dizzy for 10 years. I've been going to osteopaths, chiropractors, acupuncturists, physiotherapists, shamanic healers, loads of people basically. I've been around about 15 different people in the past 7 years. I've still got all the problems. So anyway, the nurse practitioner picked up that my blood pressure was just all over the place, that basically it happens when I change position. So the healthcare assistant realised that when I stood up, that my heart would race. So I then went on the tippy tappy on the computer to ask my GP app thingy that what about POTS? Could this be the symptoms of POTS? Which is postural orthostatic tachycardia syndrome. So tachycardia relates to the heart and maladaptive processes of the heart. So postural is your postural changes. Now orthostatic, I don't know what that means. Let me go and look that up. I would be more prepared for these videos, but what I tend to do is just stick the camera on. I get the energy, the thought energy, and I just stick the camera on, shove it in front of my face and start talking. So orthostatic. Right, so it just says orthostatic hypertension on Google. So hang on, orthostatic meaning. Right, so orthostatic means relating to an upright position. So postural orthostatic tachycardia syndrome. So you're posturing upright, you're having the tachycardia syndrome. Okay, so your heart races when you stand up, which is what is happening to me. My blood pressure is going up, and it's all over the show basically. But normally I have low blood pressure. I'm somebody that has always had very low blood pressure, which is normal for me. I'm very petite. I'm 5'3". I'm not even 8 stone. I'm under 8 stone, which is surprising because normally I average out about 8.5 stone. So I seem to have lost a lot of weight, which I don't understand, but I'm getting bigger. So that doesn't make sense. I must be losing muscle mass. Which none of it makes sense. So I think the scales are wrong at the GP surgery anyway. They've got those really old-fashioned ones there, so I don't understand it. But I'm petite anyway. I've always been petite. So I then went on the Tippy Tappy, the GP app, and asked if I could be investigated for POTS. So, and it's just pointless really with the NHS, because you just get passed from pillar to post. And I actually went to a GP probably a couple of weeks ago, and I got massively triggered. He wasn't listening to what I was saying. I went in about my jaw and my shoulder and asked if I could get a steroid injection or some steroids or something to help my body recover, because my body's not recovering quickly, and just got totally palmed off. He told me to have a reframe, basically that my health issues would get better, and he told me to eat more food, and he was completely obsessed with what I ate. He asked me like 5 times in this 15-minute session of what I ate. I mean, what's that got to do with anything? I said to him that I was a health and wellness practitioner. Fair enough, ask somebody once, but why ask 5 times? It was very odd, very, very odd. And well, come to think of it, I went in there and he had food all over his mouth, so he was hungry. So he was thinking about food, and he was obsessing about food because I'd obviously interrupted him eating his sandwich, his 11's snack. So yeah, and so he projected that obsession about food and hunger onto me, which is just annoying. So he wasn't entirely present in the room. Today I had a look at the screen. The healthcare assistant went out to get this to get the label for the ECG machine for the stickers because I have a latex allergy, and I asked her if it contained latex and what was in the glue, and said that I have allergies. Now, I've had a cup of tea, so that's why my throat's going funny. So yeah, the GP was completely obsessed with food and what I ate because he was hungry, basically. So I got gaslighted again. They didn't give me any steroids. They said that there's no treatment at all under the NHS for TMJ, apart from self-referral to physiotherapy, and they're useless on the NHS, absolutely useless. They just don't have the adequate training. So he just basically said to keep going back to my chiropractor and keep going back to my sports therapist, and thank God I have found a good sports therapist, although he's borderline inappropriate, if not inappropriate actually. But anyway, so this is progress. We have the heart monitor to see if I do have POTS, to see if there is something seriously underlying, because I've had chronic health problems for well over a decade, and then I've had PTSD for 20 years and other traumas as well, and I know why my PTSD happened, because it was a run-up into what was happening in my life before the birth of my eldest child. So yeah, but that's a whole other video, isn't it? A joyous, happy video. So anyway, this is supposed to be positive, but it's also serious, because I could have dysautonomia, which wouldn't surprise me after having 20 years of chronic stress. It's basically dysautonomia is when the nervous system trips out, so the autonomic nervous system, so the one that controls breathing, heart rate, digestion, all the ones that you don't think about, basically. So it's the ones that work automatically, like when you're asleep. So yeah, and I just feel very much out of breath, but I've eaten a big meal. That tends to happen when I eat a big meal as well. I've probably eaten far too quickly, and yeah, I haven't really had a meal today. I've just had like an apple and half a flapjack. So yes, I've made myself a nice meal because I've got the evening off work, so that's a good thing, that I can take some time out and just have a little rest. And then I've got this clinical form to fill in, so if I get a palpitation or if I get any weird symptoms, then I have to put them in on this form, and it has to be within 15 minutes. So yeah, so that is that. So I'm under investigation for POTS now, but I want to highlight that this wasn't because of the HRT. This wasn't, excuse my top, this wasn't, the POTS symptoms happened before I started the HRT. So I've had the POTS symptoms. I just want to reiterate that point, because I don't want people to think, wait, what? she was on HRT, now she's got dysautonomia. No, it's nothing to do with that. It's because, like I say, 20 years of chronic stress and severe allergic reactions to medications that I had in 2017. So, 7 years ago, what's that, 7 years ago? 17, 18, 19, 21, 2, yeah, 7 years ago, where I had severe allergic reactions to medications and actually had the flu shot as well, flu vaccine, around about that time, because I was so run down. I'd come out of an abusive relationship and I was just a wreck, a complete wreck, and I thought, right, I better take the flu vaccine against the advice of my chiropractor at the time, who said, no, they're like full of heavy metals, they're full of like mouse brains, and you think, what? Why are they full of my mouse brains? What the hell? And I had a back and forth with a pharmacist, and she was like going against what the chiropractor said, and the chiropractor was like, no, just rely on your immune system. And I should have listened to him. I should have listened to him, because now I've got all these problems. My health has just taken a downward spiral, but it's on the up. I see it as on the up. Even if I've got this dysautonomia, I still feel like I'm on the up, because it's, you know, thank God for the nurse practitioner who did my HRT review. Otherwise, it wouldn't have been picked up. But a relative, actually, funnily enough, a relative said to me, probably about 6 years ago, she gave me an article in a magazine and said, oh, read this. And it was, what's the name? I've got a cookbook on the shelf. Deliciously Ella. Let me grab the cookbook. What's the name? Yeah, so a relative said about this lady, Ella, what's her name? Ella Wood. I haven't got my reading glasses on. Ella Woodward. So this chick, she had POTS, and when my relative got me the magazine, she's like, maybe you've got this, you know, maybe you've got this. And I was like, I don't know. I think I've just got PTSD, you know, and like chronic fatigue, ME type thing. But maybe she was right, you know, maybe I should have paid more attention to that. But I most certainly am having a lot of weird symptoms as well as the musculoskeletal ones. I find that if I eat too many grains, like too much carbohydrate or grains, like I'm gluten free, I'm dairy free, but if I eat my gluten free bread, if I have too much of it, I'll get a massive insulin spike and I'll go a bit loopy, I'll get like really chatty, and it's like ADHD symptoms actually, which leads me to believe that a lot of people who have been diagnosed with ADHD actually have food intolerances and have like a metabolic issue. So it can be gut, it can be metabolism, it can be endocrine. Gut dysbiosis as well is a massive one. So I've just had a delivery actually, let me go and grab that. Diatomaceous Earth. I've just had this delivery. Now I don't know anything about this brand, and this tub is actually a lot bigger than what I thought, because I'm sure it said 500 grams, but that looks massive. So yeah, I mean 500 grams, okay, I guess that's right. So this was a spiritual lady who I follow, on YouTube, recommended the Diatomaceous Earth for detoxing, and it's silica, and it comes from crustaceans apparently, and it basically provides the building blocks to collagen, and it's good for your skin, hair and nails and things like that. And people use it on chickens and cats to get rid of fleas actually. If you have an allergy to shellfish, then you can't take it. But I've noticed some of these actually say they're vegan, so I don't know how they work that one out. But this one doesn't. It just says diatomaceous earth powder, 94% silicon dioxide and trace minerals, crystalline silica. So you take this apparently like a small tablespoon in a glass of water every day for 30 days. This is what was Laura's advice. So you take it for 30 days to have a detox, and then you leave it 30 days and then it's like a 30-day on, 30-day off, and you do that for 3 months. It's probably 6 months, isn't it? But you're taking the detox for 3 months. So I'll see how I get on with that. It might make my nails and things grow stronger. That would be nice. But yeah. But I also take activated charcoal for a detox. But apparently that doesn't kill parasites. What else do I take? Iodine. I take iodine as well. I'm actually going to do another video with supplements and stuff. But yeah, I take iodine for thyroid, because when you've had chronic stress for decades, then it affects your thyroid, affects everything, doesn't it? So just to be on the safe side, they used to put iodine actually in table salt, but they stopped doing that, I believe, in the UK. I don't think they do that anymore. Or they used to put it in bread, but I'm gluten free, so I've never noticed that that's an ingredient in the bread. I read the ingredients for everything I put into my body, basically. Before I ingest anything, I'll read the ingredients. But yeah, time will tell. Time will tell if this ECG, I have no idea how long it takes to get the results for this. I suppose they'll probably just put it on my medical notes, and then I'll have to log in to the NHS app and check it. But yeah, anyway, that is that. Wish me luck with my POTS diagnosis and research. Apparently the next stage is going onto a tilting table, so that will be fun. Being spun around, I guess, I don't know, just being strapped to a table. I'm sure that will trigger some past life trauma. Yeah, not looking forward to that one. Really not looking forward to that one. I could just stand there and do some burpees and get the same problem. Or I could just walk down my staircase and then they could measure my heart rate and my dizziness from that. So I don't need to be flipped around on a tilt table. But you have to humour these people, don't need to get anywhere. So I'll probably come back to this in another year's time, and I'll still be waiting. I'll still be waiting for the diagnosis. How do I turn this off? Oh God.